Good afternoon. Thank you so much, everyone, for joining us today. My name is Katie Metz. I'm with National Disability Institute, and we really welcome you in joining us for our webinar, The Extra Costs of Living with a Disability. Next slide, Hope. So again, my name is Katie Metz. I'm the Director of Financial Resilience Center here at National Disability Institute. And I work very closely with my colleagues, Michael Rausch, Lori Schaller, Kish, and Katie Achenbach, as well as, as Hope on the Illinois DD Council project. So next slide, Hope. If you're listening to the webinar today, the audio for today's meeting can be accessed by using your computer audio or by calling in by phone. If you select computer audio, please make sure that your speakers are turned on or your headphones are plugged in. If you do not have sound capabilities on your computer or prefer to listen by phone, you may dial 1-929-205-6099 with the meeting code 873-8053-3325. And we will put that in the chat as well. If you would like to use the captioning services, they are being provided in real time during the webinar. The captions can be found by clicking on the CC button in your Zoom controls at the bottom of the screen. If you do not see the captions after clicking the button, please alert the host via the chat box, and they'll help you out with the closed captioning. Next slide. If you'd like to submit questions, we will take those at the end of the webinar. So please use the Q&A box, and you can do that throughout the webinar. So if you have any of those, put them in the Q&A box. We will answer some of them as we move throughout the webinar, and if not, we will direct them accordingly towards the end of the session. We have left time for a Q&A session. And if for some reason we do run out of time and your question's not answered during the webinar, or you're listening by phone and you're not logged in, you may email myself, kmetz@ndi-inc.org. If you require technical assistance during this webinar and you're having any difficulties, please use the chat box to send a message to the NDI host, or you may email our host at hprice, P-R-I-C-E, at ndi-inc.org. Please also note, we get this question a lot, this webinar is being recorded and the materials will be placed on the following websites, both our National Disability Institute website at the ICDD, Illinois Council Developmental Disability Financial Wellness Webinars page, as well as on the Illinois Council on Developmental Disabilities website. With that, I really would like to give a very warm welcome and a thank you to Dennis Deeney, who is the program specialist at the Illinois Council on Developmental Disabilities, who has so graciously joined us today to say a quick hello and a welcome to everyone. So Dennis, with that, I'll turn it over to you.
Thank you, Katie. Good morning, everyone. My name is Dennis Deeney, and I am a program specialist for the Illinois Council on Developmental Disabilities. I'm very happy to have this time to join the webinar this morning just to say hello and also to welcome everyone. So I want to talk a little bit about the council very briefly. Some of you may be familiar, but for those of you who are not familiar, the mission of the Illinois Council on Developmental Disabilities, which is also referred to as the Council, is to help lead change in Illinois so that all people with developmental disabilities can exercise their right to equal opportunity and freedom. We are a 100% federally funded program that is self-governing, and we are charged with identifying the most pressing needs of people with developmental disabilities here in the state of Illinois. All councils are committed to advancing public policy and systems change that help these individuals gain more control over their lives. The council works to address identified needs by conducting advocacy, systems change, and capacity building efforts that promote promote self-determination, community integration, and inclusion. Currently in Illinois, we have 22 different investments across the state, with NDI being one of them. I want to just make a quick note. Please be sure to visit our website by searching icdd.illinois.gov. That's icdd.illinois.gov. And look under announcements for our ICDD e-news and to sign up to receive notification of upcoming trainings or webinars. Also, you can find summaries of ICDD press releases, learn about our calls for investment, find our contact information, and receive a lot of other exciting news as it happens. You can also subscribe to our listserv by emailing icddinfo@illinois.gov. Again, that's icddinfo@illinois.gov. I really want to take this time to thank National Disability for all they are doing to provide information, resources, and financial empowerment for people with developmental disabilities, not only here in Illinois, but nationwide. With that said, I will hand it back over. Thank you.
Thank you so much, Dennis. Thank you for joining us today and all of the wonderful work that you're doing in Illinois. So with that, I just want to give you a quick intro. If you are joining us today and you not previously have heard of National Disability Institute, it's my pleasure to introduce you to our organization, tell you just a quick little bit about who we are and what we do. We are the first national organization committed exclusively to championing economic empowerment, financial education, asset development, and financial stability for all persons with disabilities. Our mission really is to collaborate and innovate to build a better financial future for persons with disabilities and their families, to really someday achieve our vision of a society in which people with disabilities have the same opportunities to achieve financial stability and independence as people without disabilities. We do this in a variety of ways, including influential thinking, pioneering research, advocacy, policy development, training, technical assistance, and a multitude of other innovative initiatives. We work with state, federal agencies, and we're very excited to be able to work with the Illinois Council on Developmental Disabilities over the past couple of years to really further our mission to work and really strive to make sure that individuals who are living in disability, both persons with developmental and intellectual disabilities, and of the others, family members, providers, really have the resources that they need to be able to really help individuals with disabilities achieve their financial stability and independence. So with that, I do want to thank once again the Illinois Council for Developmental Disabilities. Next slide, Hope, for supporting us in this work that we're doing throughout Illinois. Next slide. Today, we're going to talk a little bit more as we talked about in our mission, we really work towards both research as well as training and technical assistance and putting the research that we learn about into action. And so today we'll talk about the extra costs of living with a disability and the research that has been done around that, as well as some tips on how we can tie that together. So budgeting and saving for those extra costs. As I mentioned previously, at the end of the session, we'll leave some time for questions and answers. If we somehow don't get to one of your questions, then we will certainly make sure that we post that Q&A, or you can contact us through the chat box or through other means that we'll give you a little bit later on, and we'll make sure we get your questions answered. And then finally, we will sum up with some resources and announcements. Before we get started, we're going to do a quick poll so that we can kind of see where everyone is when it comes to these topics. So with that, I'm going to ask my colleague Hope to go ahead and launch a poll, and we'll give a quick 30 seconds to answer that. And those questions are, how much do you know about the topic, the wide range of additional costs for a household that include a person with a disability? How much do you know about ways to budget for those extra costs that may come with living with a disability? And then finally, how much do you know about ways to save extra for those costs that may come with living with a disability? And again, it's okay to be anywhere on the board with this. We just want to get a kind of a borderline of where everyone might be. So we'll give just a few more seconds if you could enter in. Okay, we'll go ahead and end the poll. With that, we'll go ahead and get started. So it's my honor, next slide, Hope, to introduce one of my colleagues, Nanette Goodman. She is currently the research director at the Burton Blatt Institute, Syracuse University. And prior to being with Burton Blatt, Nanette was our research director at the National Disability Institute, where she provided technical assistance to a multitude of programs, including this one with the Illinois Council on Developmental Disabilities. And for the past 15 years, she's been using quantitative and qualitative research methods to really analyze disability policies throughout the US and developing countries so that we can learn more in order to make a difference in the world of persons with disabilities in the future. So with that, I will turn it over to you, Nanette.
Thanks, Katie. You can forward the slide. So today I'm going to be talking about a study that I did with Zach Morris at Stony Brook University, Steve McGarity at the University of Tennessee, Knoxville, and Michael Morris at NDI. And it's about the extra cost of living with a disability in the United States. Next slide. So just to sort of level set here, when we talk about financial stability, right, it's a balancing act. We're looking at income and expenses and our assets. Next slide. But we already know a lot about income. We focus a ton on income, but we rarely consider expenses when we're developing our public policy. So on the income side, for example, we know that people with disabilities are less likely to be employed and thus less likely to have income from wages. We know that even if they are employed, they have lower wages than those without disabilities. And we know that they are more likely to be low or moderate income or live in poverty. And that poverty measure is kind of interesting because when we think about whether somebody lives in poverty, that's really an income measure. The poverty rate implicitly assumes that everybody with a certain level of income can theoretically buy the same basket of goods. So the poverty level is sort of a minimum basket of goods. And we're saying that if you have this income, you should be able to buy that basket of goods. But what we're going to show here is that that isn't the case, that people with disabilities have measurable and significant extra expenditures so that they can't necessarily buy that same basket of goods, or more importantly, that basket of goods is not adequate for them to participate in society. For them, their basket of goods can be different. As a result, our poverty measure understates the true level of economic hardship that households, including a person with a disability, experiences. So that's what we're going to be talking about today. Sort of what is that how do we measure that out of pocket, those extra out of pocket expenditures? Next slide. So what do we mean by the extra out of pocket costs? So people with disabilities face two types of costs. One is these indirect costs. So we know that in the survey, we found out that like 65% of you guys say, I know a little or a lot about these extra costs. And I bet you do. I bet that you know both about the indirect costs and the direct costs. So the indirect costs are those foregone earnings that people with disabilities have because they face barriers to work, right? So people with disabilities may not be working because they can't get a job. So that's one of the indirect costs. Another indirect cost is that family members may have to reduce their amount of paid work to provide care and support for their family member with a disability. But these costs are counted on that income side of the equation. But what we're really focusing on today is the expenditure side of the equation. So those are sort of those extra out-of-pocket costs like personal assistance services, healthcare costs, housing, accommodation, assistive technology, maintaining service animals, and things like that. And the interesting thing is that these costs really fall into two categories. And I think it's really important when you're thinking about helping somebody with their budget to think about these categories. The first are disability specific costs. Like I said, like personal assistance or assistive technology. These are costs that people without disabilities don't face. And they tend to be very well defined. The second group of costs are things like the extra cost of finding housing that's accessible and convenient, the extra cost of transportation, the extra costs associated with a specific diet. Everybody needs a house and a way to get around, and they need to eat, but people with disabilities might face extra costs for these things. So if you're a financial counselor, I know that you look at the needs of each person individually, but I think it's important, it's worth keeping these costs in the back of your mind as you're doing the financial counseling, especially if you're thinking sort of in the back of your mind. It seems like this person should be able to make ends meet given the income that they have. Why is it that they can't? And that's when some of these extra costs really come into play on a very individual level. Next slide, please. So we have this research question. How much additional income does a household containing a working age person with a disability require to have the same standard of living as a similar household without a member with a disability? And let me just step back to say, we're using a very broad definition of disability. I know that you guys are interested specifically in intellectual disabilities, but unfortunately that's the data just wasn't out there to sort of break down by disability type. So we used something called the standard of living approach. And the way the standard of living approach on a sort of techie way, it says the approach uses multivariate regression. It's a statistical approach to estimate the additional income required to bring the same standard of living of a household containing a person with a disability as compared to a comparable household without a member with a disability. So in English, what this basically means is that if you have two families that have very similar characteristics, where they live, the income they have, their household size, you expect that they should have some similar levels of expenditures. So we would expect that for two similar households with similar incomes, they would have around the same standard of living. But what we can do is we can statistically measure the difference in the standard of living between one family that has a household member with a disability and one that does not. And then what we say is the difference in the standard of living is sort of these extra costs that we're trying to estimate. I hope that kind of makes sense, but basically it's a statistical approach. There are other ways to measure the extra costs. We could ask a ton of different people what costs they face. And there's actually a strategy out there that's being used internationally where you kind of go through a list of, do you use this, for each type of support and service that somebody could potentially need? How much do you spend on this? And in the future, we hope to be able to do that kind of research. But the standard of living, the statistical approach is a much more time and cost efficient way to do the estimate. So that's what we did the first time through. So next slide. So what we did is we looked at data from 4 nationally representative surveys. We consider standard of living, sort of this idea of, how well are you doing financially? Are you just getting by? Are you worried that the money you have won't last? So that's sort of how we're thinking, you know, what is your level of financial stress? And that's how we're measuring standard of living. So we use 4 different surveys, and then we look to say, well, what would the poverty rate be if we adjusted the poverty level based on these extra costs? So go next slide. So what did we find? So we found that across the 4 surveys, adults with a disability are estimated to require 28% more income to achieve their living standards compared to similar households without an adult with a disability. And I think that's the number that you should come away with, 28% more. This is on average, but that's a big number. So this translates to an extra $17,690 per year for a household at the median income level. Households vary by certain characteristics. For example, married people with disabilities tend to have lower out-of-pocket costs than single people. But the thing that, as researchers, the thing that was very exciting to us is that we used these 4 different surveys, and we got really similar results. So that convinces us that this is about the number that is the true extra cost of living with a disability in the US. It's also consistent with other research that has gone on internationally. So that's the number to think about, 28%. Next slide. So what would happen if we said, okay, well, let's look at the poverty level if we adjust for this extra cost. And what we find is that right now, the poverty rate for people with disabilities is about 24%. That's about twice what it is for people without disabilities. But if we adjusted this for the extra cost of living with a disability, the poverty rate would be 35%. And when we think about eligibility for SNAP, that's based on 133% of the poverty level. Right now, 35% of people with disabilities have incomes 133% of poverty or below. And if we adjusted, it would be 45%. And when we talk about the maximum income to receive a health insurance subsidy, right now, 75% of people with disabilities are at that income level, and it would be 85% if we adjusted for the extra costs. So if we adjusted for the extra costs, we estimate that approximately 2.2 million more people with disabilities would be counted as poor. And if we, and this would expand, and if we sort of keep the same standard for eligibility for public programs, this would expand eligibility for many health and public benefit programs. Next slide. So what do we do here in the United States to look at these extra costs? And, you know, we actually do, we do recognize the extra costs in legislation. And I'm mentioning this because as we think about, well, why do we care about these extra costs? We certainly care about them as we do financial counseling, but we also care about them on a policy level. You know, what kind of policy changes can we make that would address the issue? And what we see is that this isn't really a pipe dream, that we have, that these extra costs are addressed sort of in a catch-as-catch-can way in several pieces of legislation. So when passing SSI for children in 1972, Congress specifically said poor children with disabilities should be eligible for SSI benefits because their needs are often greater than non-disabled children. They're saying the families need extra money because the needs are greater. ABLE recognizes these extra costs by allowing individuals to save for disability-related expenses in a tax-advantaged account that's not considered an asset when determining eligibility for means-tested benefits. But the interesting thing is that while sometimes these extra costs are noted in legislation, they're more often sort of subtly included in administrative rules. For example, in SNAP, people with disabilities, and where people with disabilities are defined as people who are receiving benefits, they're exempt from the gross income threshold. So they're allowed certain deductions from net income that people with disabilities are not allowed. Plus they have a higher asset threshold. So people with disabilities are allowed a little extra income and still qualify for SNAP. Many people, of course, qualify because they're SSI eligible, but this is talking about people who are not SSI eligible. Next slide. So we also recognize these extra costs in tax code. We have the larger standard deduction for people who are blind. We have a deduction for impairment related work expenses for workers with disabilities. And we have a deduction for medical care expenses. The interesting thing about the deduction for impairment related work expenses is that one of the things that we find in the research is that, we talk about these extra costs as an average, but really the extra costs are related to what you're trying to do, right? If you're staying at home all the time, your extra costs can be very low. But if you're trying to go out to work or trying to fully participate in society, then your extra costs might be a little higher. So the research does show that there's this extra out-of-pocket cost related to working. The other place it shows up most clearly is in the personal budgets in Medicaid, where we specifically look on a person-by-person basis, where participants are allotted a customized budget. So we're looking at really what exactly are those extra costs. And then we also have these other in-kind benefits, which are designed to reduce the extra out-of-pocket costs, like long-term care and personal assistance services and housing assistance. So next slide. So you're probably thinking, this is kind of interesting, but so what can we do with this? And there's a few, and we do recognize that there are limitations, right? The first one is that the first question you're going to ask is, so what exactly are these kinds of expenses? And how can I list them? And what's driving the costs? And in terms of adjusting public policy, we do need to know this. We are looking really at a very broad average cost, and we do need more research to understand the types of expenses and their relative impact on the budgets. The other thing is that the estimate provides this average across all people with work disabilities, but it can't be used to identify the extra cost for each individual. It also talks about the average across all people with disabilities, but it doesn't, like I said, it doesn't address sort of those extra costs associated with actually participating in society. One of the big things that's really important in the ID community is that it doesn't provide information on how living with the disability affects the income of the individual or the family member. For example, if a family member reduces their work hours to provide care, that lost income is not captured in this 28%. Like I said earlier, that's on the income side of the equation. But we know that family members, and especially mothers, often reduce their work hours to provide care. And from a public policy standpoint, we do have to address that as well. And the other thing that's really important is that this tells us generally what people are spending. But the problem is, if you don't have money for transportation or money to go to the movie, you don't go to the movie, and you just don't participate fully in society. So the question is not what is it that, the true question that we want to ask is not what are you currently spending, but what is it that you need to spend for full participation? And that's a much more difficult question. There are some sort of research approaches to get at that, but it's not, it's a really important question. I know it sounds kind of researchy when we talk about it, in terms of sort of what the dollars you need to spend to participate fully in society, but it really is on a very individual level. What does it mean to fully participate, and what do you need to get there? So we talk about full participation in terms of the services and supports, but we need to also think about full participation in terms of what financial resources you need. And when you're talking about budgeting, that's also a challenging question, because you talk a lot about, needs versus wants, but what is it that people, what is full participation, and what do you need for full participation? I think it just sort of opens up a whole new question about finances when you think about what you need to fully participate. And I have to say, I got a great comment, forgot the cost of a wheelchair and constant equipment repairs. That's very true. There are tons of costs that we forgot that we don't list. And the interesting thing is that there's some Twitter chats called like Cryptax or something like that, where people go online and they just list these extra costs, and it's one thing after another, and the frustration that people feel in all these little costs, many of which are not recognized, can be really frustrating. When Starbucks was considering charging for straws, the disability Twitterverse went crazy. Like, are you kidding me? Yet another extra cost? That's, it's just a few cents here and there, but those few cents here and there add up. And of course, the larger costs of wheelchairs and equipment repairs. Next slide. So what is it that we should do? So we need to think about how this kind of research affects, should we change eligibility standards for food and housing assistance, recognizing these extra costs? Should we change eligibility for Medicaid, recognizing the extra costs? Should we change who's eligible to open ABLE accounts? Should we change how much funding is available that you can contribute to ABLE accounts, understanding now the breadth of these extra costs? And then for financial planning, you really need to think about the long and short-term financial needs, and examining financial savings and investment choices. But like I said, I think it's this research kind of gives us a basic number, but doesn't give us some of the specifics that we need to figure out exactly what changes we should make. Next slide. But for all those advocates out there, I really hope it gives you some fodder to work with. So we have a policy brief, a working paper, and an infographic that you can get more information. And I think, Hope, you were going to put the link to that into the chat. And next slide. And I think that's it for me. I think we go back to Katie now.
Yeah, great. Thank you so much, Nanette. Really good information that, as we all know, really hasn't been thought about, I think, by many, especially those outside of the disability community. So it's really wonderful to see that that report and that information where we can both learn internally, but also share with others. And so we thank you for that. And if you have any questions, again, put those in the Q&A and we will direct those to Nanette after our next presenter and during the Q&A session. So with that, I'm going to move on to our next presenter, who is my other colleague, Bridget Graham, one of our managers under Financial Empowerment at National Disability Institute. Bridget has been a financial coach. She brings more than 10 years experience working with a lot of different populations as a social worker. And so, Bridget, we welcome you to talk to us a little bit more about, now that we've heard a lot of these extra costs when it comes to living with a disability, some tips on ways that we can budget and save to help with the expenses of those costs. So with that, I will turn it over to you, Bridget.
Thank you so much, Katie. As we heard earlier, Nanette talk about the wide variety of extra costs that people with disabilities face daily. I just thought about, how do we even begin to have the conversations about budgeting when there's already a challenge with the money that they're having to live off of and cover their living expenses with. I think it's very important to make the ends meet in your home. Of course, we all want to make sure that our roof and our housing is good. But I also want you to think about how we can make every dollar in your household count. I've put together a couple of money management tips that I think can help ease some of the financial burdens. I do think developing these money habits can help you feel more control of your life and your finances. So next slide. The first thing that we have is to create a spending plan. The spending plan allows you to prioritize your spending and really focus on your money and things that are important to you. It can help you make sure you have money to pay bills on time, even when your bills and income may change each month. Essentially, the spending plan allows you to give your money a job. We also want you to list all of your fixed expenses. So fixed expenses do not necessarily change from month to month, but we also want you to understand that some of those may incur extra costs of living. So for example, your rent may be a little higher because you're having to live in a place that is accessible to you, and your car payments may be the same as well. Your variable expenses range from month to month, and it really depends. These may be utility bills, buying groceries, your gas, your electricity, cable, and shopping. And we all know that there are extra costs associated with both the fixed and variable expenses. Some of these expenses fall into both categories, so they can be fixed and variable. So I want to be very mindful of saying that, because those expenses, while they may not be anything that is thought about for people without disabilities, for people with disabilities, they may vary significantly depending on your personal circumstances in your household. Some examples that come to mind are, the rent may be more expensive because you need a place that is accessible and convenient to live. You may have to order your groceries or medications online because there is not a pickup option in store that is accessible to you. Or you may even have to do car modifications just to get around in your area. We also want you to look at and determine some areas that you can cut back your expenses. This gives you the opportunity to see where you can potentially save money, like perhaps you're not eating out as much, you're maybe cooking at home more, even reducing your electricity usage. So it may be that you're cutting off computers fully at night, or changing your light bulbs to energy efficient ones in the home. And then we want you to take that money and continue to pay off debt so that you can save money. Our financial wellness tools that we have are available, and they will assist you in improving your financial wellness as well. Next slide, please. So here are a couple of our financial education tools that we have on our website. Here, what you'll see is a spending plan as well as a menu plan and a daily shopping list for groceries. These are just some of the tools that you definitely can utilize when you're looking at your expenses and how you're spending your money that is currently in your home. Next slide, please. So we talked about spending plans, which focused on knowing and prioritizing where your money is going. Now we want to take it a step further and talk about ways to save. One of the ways that we want you to think about is creating a savings plan. A savings plan allows you to break down things into bite-sized pieces. It gives you direction and provides you a way to achieve your goal one step at a time. I encourage you to add a line to your spending plan for savings. Every piece of your financial picture should have a designated spot, and that includes savings. Because you have determined some expenses that you may be able to cut back on, like eating out or shopping, you may be able to save a little more. So we want you to give that money a job. Prioritize your savings with an affordable amount to your budget. So we don't want you to take away from your rent to save. We definitely want you to pay the rent. But if there is a way, perhaps you're buying more groceries, so you're saving more money from eating out, then we want you to take the money that you're saving from eating out and put it into a savings. This allows you to save for unexpected expenses or emergencies that may come up. We also want you to think of ways to brainstorm to decrease your spending or increase your income. Some of the things that I've thought about in this is perhaps lowering your utility bills. There's a lot of energy assistance programs that may be out there, but you have to call in order to see if they're available for where you are. There's also agencies state to state that help you with food and mortgage assistance as well. And maybe it's you getting a part-time job to supplement the income you already currently have coming into the home. Maybe it's that you babysit for a family member for a few hours a week to bring in a couple of additional funds. Next slide, please. Uh-oh, went back. Oh, let's talk about NDI's Financial Resilience Center. Sorry about that. So NDI's Financial Resilience Center has an awesome research page that answers frequently asked questions to help people with their disabilities and families manage their money more effectively. There are resources about managing your money. There are tabs that talk about paying bills and they answer questions. And there's also money skills and banking options as well. All these sections link you to great national resources and also to our financial wellness tools as well. Next slide. So now we've thought about some ways to save. Let's talk about some options for where to save your money. Of course, we have bank accounts and credit unions, and those are the traditional options that are available when you're looking for a bank account. Credit unions are more membership-based nonprofit organizations, while banks are more for-profit entities, Each one has a different fees and guidelines in which you should research prior to making a decision. We also have the Achieving a Better Life Experience accounts, which is known as ABLE accounts, which was signed into law in 2014. These accounts allow people with disabilities to create tax-advantaged savings accounts. Money in these accounts can be used for qualified disability-related expenses, such as education, housing, and transportation. It also allows you to save money without losing your eligibility for federally funded benefits, such as Medicaid or SSI. Next slide. So what I would like for you to do before you choose a banking is to choose and compare. The FDIC Model Safe Accounts template is a checklist of guidelines that can help you find a traditional bank account. It gives a really good breakdown of things you should look for in a transactional or basic savings account, such as if you need an opening balance, what are the maintenance fees, and if they have money orders or check cashing fees as well. The financial wellness tools that we talked about earlier also has a great downloadable banking worksheet that gives you great questions to ask or look up when searching for a bank account. The Illinois ABLE website is great when looking at ABLE account options. They have an awesome eligibility quiz that you can take to see if there's a good fit for what you need in an account. And Illinois ABLE also allows you to open an account no matter what state you're in. I would suggest first that you look at the plan in your state as well before opening in another state in case there are tax or other advantages in your home state. The ABLE National Resource Center is a good starting point for ABLE accounts as well. They have a step-by-step guide that walks you through from eligibility to enrollment. I encourage you to use the 3-state comparisons tool, which allows you to see if you are able to get an account in your state and also compare to 2 other states to see what the fees may be and if they are FDIC insured. It's a great option as well. Next slide. Here are some of the resources that we utilized earlier. I hope that these few tips that I've shared will help you guys be able to budget the extra costs of living. And take it away, Kitty.
Great. Thank you so much, Bridget and Nanette. And so I am going to let Hope take back over the slides. Hope, is that okay with you? So I can multitask here with the Q&A. Great. All right. So if you have any questions, now would be the time to definitely put them in the Q&A so that we can answer those for you. I did see one question that came in from Mickey about are these budget sheets and associated resources available on the website as well? They are, so we can put those in the chat now. Those are the links that we just provided on the last on the last slide. But we also can, we also will have the PowerPoint available on our website as well, so that you can directly access both the slides and all of these wonderful links and resources that are being shared. If there's any additional questions, then go ahead and send those in. I do see one that has come in that says, with regard to your research, were there any indicators of costs being higher or lower for one type of disability or another? Nanette.
Unfortunately, the data sets didn't support that level of analysis. That's definitely on, on our sort of research dream list, but we weren't able to do it with this data.
No problem.
So,
and then another question that came in is there any research on this topic specific to Illinois?
Not that I know of.
Okay.
This is actually, it's kind of interesting that this is an issue that is being researched internationally more than it's being researched in the United States. So it's not down at the state level.
Great.
Yeah, I mean, I think there's really an opportunity, if you want to do something at the state level, to do one of the other approaches where you really survey individuals. I can give you a whole survey methodology to come up with some state level estimates. But we haven't done it.
Someone else did ask too, how can we as members of the disability community advocate to make changes to the policies you mentioned?
Are there still folks from the DD Council that can
I think Dennis left us.
Okay.
Unfortunately.
Yeah, I mean, I think it's about uniting behind a specific policy and using your networks. I think, and I think, for the extra costs, just talking about it at this point, I think is really important because it is a new concept for a lot of people. I mean, it is, like I said, it's sort of in our public consciousness a little bit when you look at our laws and regulations, but it's not really explicitly in there. And I think to talk about this is in a very explicit way and sort of get that on the radar screen of policymakers is really the first step. So as you meet with policymakers, I mean, it's amazing how often you can bring it up. Almost any topic you're talking about, you can also talk about extra costs.
Nice. Very true, right? And bringing the research to the individuals who probably don't see them.
Right.
Sharing that with your as constituents as well. Somebody else did ask too, Nanette, how do you think these numbers might change post-pandemic?
That's a really interesting question, because I think that goes to that issue of, you know, it was probably less expensive during the pandemic because nobody was trying to get out of the house. Getting out of the house can be expensive. I think now that we're sort of going back to our pre-pandemic levels, I don't know how it's going to change in the long term. You know, did we change some of our more expensive tools for less expensive tools? Have we figured out a way to get to not use quite as much personal assistance services because we weren't able to get personal assistance, so we found another approach? You know, so those kind of things might happen, but I think it's sort of too early to tell if it really is going to affect our costs. I think the other, you know, the other thing is, you know, in terms of, let me go back to the advocacy question, is, you know, there are these out-of-pocket costs, and it's striking that they're out of pocket. So when we're thinking about, well, what do we do about these high costs, one of the options is to make sure that government is covering those parts of the costs that they can potentially cover. And that means making sure your home and community-based waiver services are, you know, as robust as humanly possible. And I know that, you know, the DD Council really works hard on, you know, on advocating on behalf of people with disabilities for HCBS services. I am chastened because somebody in the chat said costs skyrocketed during the pandemic for children who require care in the home and weren't able to attend school during the pandemic. My bad. I apologize. You're right. I think that's the thing about the extra costs, is that they're so different for each person and for each situation. And from a public policy standpoint, we have to figure out what it is that's consistent enough that we can make policy based on.
Yeah, I agree. And you know, it really is relative, right, to everyone as an individual, and especially as an individual with a disability and the situation. So very true. I'm going to have one more quick question before we go into wrap up. And if there's additional questions, as I mentioned, you're welcome to email myself, kmetz@ndi-inc.org, or continue to put them in the Q&A, and we'll get to them, make sure we get answers to you. But the other question we had that came in, Bridget, you might be able to help. Someone wanted to know, how do we learn more about opening an ABLE account?
Sorry, I was on mute.
It's okay.
So there are a couple of different options. I know if you go to our actual website, it will link you to the ABLE NRC account, the ABLE NRC website. It will walk you through the process of how to open an account. It's definitely one that I utilize a lot when I'm helping clients, only because they want to really see what is going on, how the process works, and it gives a really good breakdown of those things. I'm quite sure we can get the link to you guys, but that is definitely a first step that I would say that you could utilize for that as well.
Perfect. Thank you so much, Bridget, we can put in the chat and again on the slides, both the ABLE NRC and Missouri, Illinois ABLE, or Missouri, excuse me, Illinois ABLE as well, so that, wrong state, sorry guys, so that you can also go ahead and access that information on your own. Before we wrap up with just a final few words, we do want to do a quick poll again, and that poll is just so we can kind of gauge, did we help you guys out? So hope you can go ahead and launch the poll for us. Did you learn a little bit today? So we're asking you the same questions, but we really just want to gauge, you know, if we were able to share pertinent information with you. And again, if you could fill out those questions for us now that you've heard from our presenters, Nanette and Bridget, and hopefully we were able to really provide you with a lot of good information today so that you know a little bit more about the extra costs of living as a person with a disability in a household, not only just the research and the information that's there so that you can now share that with others and in a report format that might be able to help with either advocacy or policy or anything else you might be working on. And also we were hopefully able to share with you some tips around how ways that you can maybe budget and save for those extra costs, or share with others that you might know how they can budget and save as well. So thank you for filling out the poll, and you can end that anytime now and move on to the next slide. Again, if you had any additional questions, you can contact us at ask@ndi-inc.org, and we will make sure that we get our questions, all of your questions answered. And then we also want to tell you about our next slide, please, webinar that will be going on coming up in July. That will be on housing. We know it's a huge topic. Housing and transportation are often two of the largest topics that we hear about in the disability community, especially in Illinois, we know. So please join us July 21st at 11 a.m. Central as Lori Baker, who's the president and CEO of the Association of Individual Development in Aurora, presents different affordable housing options, ways to collaborate and create pathways for persons with disabilities to obtain those supports to secure housing for living independently within the diverse communities of Illinois. And we will also touch on some resources around how individuals can maybe learn ways to save and purchase their own homes. And then finally, right as we wrap up, next slide, I want to thank once again our funder. None of this would be possible, the information that we are allowed to share and hopefully allow you to share with others. The Illinois Council on Developmental Disabilities. We thank them greatly for funding this project and allowing us to continue to spread the word around financial education and empowerment for persons with disabilities and their families. I want to wrap up by thanking again our presenters, Nanette and Bridget, my colleagues behind the scenes, Kish and Katie and Hope, and we hope you learned some valuable information today that you can share with others. With that, I thank you and I hope you all have a wonderful afternoon.